Welcome back to the Art of Medicine. Let's take a look at the symptoms of a rotator cuff tear and how they affect your daily life.
Primary symptom of a rotator cuff tear is that of pain, and the location of the pain can vary, but typically it's over the side or lateral aspect of the shoulder. Most patients come in and say, "Doc, I have pain right here," and they don't understand that it's their rotator cuff. Typically they think it should be on the top of the shoulder, but it's really over the side of the shoulder. And commonly it occurs at night. A lot of patients can't sleep on that shoulder at night, or if they roll over in bed on that shoulder, it just really hurts. Second most common symptom is that of stiffness. People notice that over time they just don't have the range of motion that they had in that shoulder years ago, particularly in forward elevation. They just can't lift that arm up like they used to. Third most common symptom is that of weakness. People notice they just don't have the strength that they had 5 years ago. They have difficulty doing very simple tasks such as lifting a gallon of milk and putting it in the fridge. The most common type of tear is what we call a degenerative type tear. Between the ages of 50 and 55, as we age, the blood supply to the rotator cuff slows down, and there's an area in the cuff called the critical zone that, because of the poor blood supply, starts to tear off of the bone. And that's a degenerative type tear. There's no trauma. It's an insidious onset of pain and occurs very slowly over time. Second most common type of tear is that in the weekend warrior, the overhead athlete, the swimmer, the tennis player, racquetball, guys that play softball, just with chronic overhead use of the shoulder, they're pinching that rotator cuff underneath the acromion bone, and over the years that cuff just starts to slowly tear. And then the third most common type of tear can occur in any age group. It's with a significant trauma, say a motor vehicle accident or a significant fall. There's so much force, they fall on an outstretched arm and the cuff just tears off of the bone. There are basically two types of rotator cuff tears, and this is important because the treatment is very different. A partial thickness tear is a tear in which the cuff is not completely torn off of the bone. I like to think of it in terms of a 100-page book. If the rotator cuff is 100 pages thick, a partial thickness tear is when it's torn through maybe 20 or 30 of the pages, but it's not torn all the way through. And that's important because we don't typically operate on partial thickness tears, as opposed to a full thickness tear. A full thickness tear is when your cuff's torn through all 100 pages of that book. It's completely torn through the full thickness. It's torn off of the bone. And I tell people that's like having a hole in your pants. That tear will just keep getting bigger and bigger and bigger. It will not heal on its own until it gets large enough where you cannot lift your arm over your head.
Rosemary, you've had a shoulder injury and we want to now examine you, but the most important thing is to, we've determined already, you've spoken to me and they told me that you've hurt your shoulder sometime over the last couple of months. And the most important thing when we evaluate a patient with rotator cuff problems is to look and see where the pain is, the range of motion of your shoulder, and the strength of your shoulder. So the three things that we look for with a patient with a rotator cuff problem is loss of motion, pain, and loss of strength. The first thing I'd like to do is just sort of examine your shoulder and feel where it hurts. And a lot of people with patients with shoulder problems have pain that radiates down their arm, and sometimes it begins in a certain spot. Sometimes it's even up here where the collarbone and the shoulder blade come together, and sometimes can even get into your neck. Now I'm going to just check your range of motion and you let me know if you have any pain. And this is flexion, we've examined that. External rotation. And internal rotation, I always evaluate up the spine, and I'm looking to look at a vertebral level. And we've measured her motion there, and we'll record that. And now I'm going to bring your arms out, and we're going to check some strength for you. So I'll bring your arms up here like this, and sometimes this does elicit pain. Let me know if it hurts. Hold that nice and tight, and that's pretty good. And then put your elbows by your side. Push my hands away hard. Good. Hold your hand right by your belly, hard and tight. Hold it tight. Good. And then bring your arm real close to yourself and hold it. Good. Now, Rosemary, I want you to just bring your arms up just like that, as far as you can, and hold it high. Good. And then down. I've examined your shoulder, and any of my patients that has had pain for like over a month, I think that when they have some signs of weakness, it's important that we determine why that weakness occurs. And one of the most common reasons for that weakness is a rotator cuff tear. That tear can be small, it can be large. We really have no way of determining it based on x-rays and physical exam. We can get an idea of if there's a tear, but we need that roadmap of your shoulder. And that's why I get an MRI for my patients who've had that pain or weakness in their shoulder for over a month or 6 weeks. And that will give us a good three-dimensional visualization of that tendon and where it's attached.
This is an x-ray of a left shoulder in a patient that's been having significant pain and weakness. Let's look at the parts list. First of all, this is the middle of the ball, and this is the outer surface of the ball, which is connected to the arm. The ball sits into the socket, which is the end of the shoulder blade. On the end or side of the ball, there is a rope or tendon that pulls in this direction. That tendon is called the rotator cuff tendon. Above the tendon, there are two bones that form a joint. This is the acromion bone. This is the collarbone or clavicle. Especially this acromion bone has a tendency to form some rather large spurs that dig in and, as in this patient, tear the rotator cuff tendon. This is an MRI of that same patient with shoulder pain. Let's go over the parts list. The middle of the ball, the surface of the ball connected to the arm, the ball sitting in the socket. Above the ball, those two bones that form a joint, the acromion and the clavicle or collarbone. And then, sitting between the top of the ball and the undersurface of the acromion bone is the rotator cuff. So a normal rotator cuff appears as a black band in this space. Here we see a white space that separates two parts of the black band. This white space indicates a rotator cuff tear.